McGraw-Hill Education presents The Cleveland Clinic Way, Lessons in Excellence from one of the world's leading healthcare organizations. Written by Toby Cosgrove, MD, President and CEO of Cleveland Clinic. Narration provided by Eli Woods and Company Productions. Dedication to all Cleveland Clinic caregivers, past and present, and to the patients who have trusted us with their care. Preface. Terry McCourt was expecting a baby. She was already 5 days overdue. As she sat down for dinner, she felt an unusual pain at the base of her throat. She didn't know it, but she was in mortal danger. Deep inside her chest, the largest blood vessel in her body, the aorta, was beginning to tear itself apart. If left untreated, it would rupture massively, gushing blood like an open fire hydrant. Terry and her unborn baby would die. Terry was hard to ignore as she burst through the doors of her local emergency room. She was tall and long-armed like Abraham Lincoln. And, as has been speculated about Lincoln, Terry has Marfan syndrome, a genetic disease of the connective tissue that can render the aorta fatally fragile. The disease had already killed her father and 3 brothers. Now it seemed like it was Terry's turn. Fortunately, the caregivers at Terry's Southern Ohio hospital knew exactly what to do in the case of a complex emergency that was unlike anything they'd ever seen. They called Cleveland Clinic. A helicopter arrived and flew Terry to Cleveland Clinic's advanced care facilities. With her condition worsening by the minute, a multi-specialty team that included a surgeon, a cardiologist, and an obstetrician went to work. They stabilized her and assessed her condition. She was rushed to an operating room where her aorta was clamped and she was placed on a heart-lung machine. The obstetrician stepped in and performed an emergency cesarean to deliver a beautiful baby boy. As Terry's baby was being examined, the heart and vascular team surrounded the table. Aortic rescue can be dangerous. It includes some of the most complex procedures in all of cardiovascular surgery. Few specialists anywhere have experience in the full range of techniques required. Terry's team of surgeons, anesthesiologists, technicians, and nurses went to work. They knew that it would be a long night, but they were determined that Terry would live to see her newborn son the next day. If Terry's local hospital hadn't sent her to Cleveland Clinic, she probably wouldn't have made it through the night. "We were racing against the clock," said one of the surgeons. But Terry got to see her son the next day, and after 9 days in the hospital, she was able to go home. She spent the next 4 months recovering, but eventually she went back to work as an inspector at a basket factory. Her son Seth is now in his early 20s. A typical young man, in Terry's words. He enjoys computers and spending time with his girlfriend. He also has Marfan syndrome and goes for annual checks of his aorta. Terry's case exemplifies the virtues of a unique model of medicine, a system in which caregivers work as a team. Doctors purely practice medicine, and the patient comes first. Unlike the majority of American physicians, those at Cleveland Clinic and a few other institutions aren't free agents who are affiliated with a specific hospital. They are employees of the same organization that owns the hospital, and they practice as an integrated group, behind-the-scenes facts that make a huge difference. In Terry's case, top experts in a dozen fields were able to scramble in the middle of the night to pull off a complex and unusual medical intervention. It was a seamless collaboration and the kind of everyday miracle that has captured the attention of everyone from the President of the United States to the New Yorker. We all know that American healthcare is supposed to be a mess. Yet on the frontiers of medicine, Cleveland Clinic has developed an approach to treating people that is more effective, more humane, and, surprisingly, more affordable. By reorganizing doctors and other caregivers so that they work together better, and by reorienting medical institutions in ways that embrace and enhance collaboration, innovation, patient experience, and wellness, we could solve all kinds of problems, including financial ones, that are driving our ominous healthcare crisis. We could help individuals live longer, healthier lives without bankrupting the nation. We could launch a technology revolution that would save lives. We could make visits to the hospital more pleasant and emotionally healing experiences. And we could help doctors engage with patients
Sample complete. Ready to continue?